What is diabetes? Diabetes mellitus is a group of metabolic diseases characterized by high blood sugar, glucose, levels that result from defects in insulin secretion, or its action, or both. Diabetes mellitus, commonly referred to as diabetes, as it will be in this article, was first identified as a disease associated with sweet urine, and excessive muscle loss in the ancient world. Elevated levels of blood glucose, hyperglycemia, lead to spillage of glucose into the urine, hence the term sweet urine. Normally, blood glucose levels are tightly controlled by insulin, a hormone produced by the pancreas. Insulin lowers the blood glucose level. When the blood glucose elevates, for example, after eating food, insulin is released from the pancreas to normalize the glucose level by promoting the uptake of glucose into body cells. In patients with diabetes, the absence of insufficient production of or lack of response to insulin causes hyperglycemia. Diabetes is a chronic medical condition, meaning that although it can be controlled, it lasts a lifetime. How many people in the US have diabetes? Diabetes affects approximately 30.3 million people, 9.4% of the population, in the United States, while another estimated 84.1 million people have prediabetes and don't know it. An estimated 7.2 million people in the United States have diabetes and don't even know it. Over time, diabetes can lead to blindness, kidney failure, and nerve damage. These types of damage are the result of damage to small vessels, referred to as microvascular disease. Diabetes also is an important factor in accelerating the hardening and narrowing of the arteries, atherosclerosis, leading to strokes, coronary heart disease, and other large blood vessel diseases. This is referred to as macrovascular disease. From an economic perspective, the total annual cost of diabetes in 2012 was estimated to be $245 billion in the United States. This included $116 billion in direct medical costs, healthcare costs, for people with diabetes and another $69 billion in other costs due to disability, premature death, or work loss. Medical expenses for people with diabetes are over 2 times higher than those for people who do not have diabetes. Remember, these numbers reflect only the population in the United States. Globally, the statistics are staggering. Diabetes is the 7th leading cause of death in the United States listed on death certificates in recent years.